Welcome to the Friday edition of our coronavirus virtual town hall as we begin the holiday weekend. Thanks for joining us, everybody. I'm Mary Alice Demler.
And I'm Michael Wooten. Ahead this half hour, boosting your immune system. You've asked for some natural solutions, and we have a dietitian weighing in.
Plus, you've heard about contact tracers, but what exactly will they be doing? We have a step-by-step look at this important work.
And how are gyms preparing to eventually reopen? We're kind of looking at what's happening in other states. First, though, let's get to the 3 things you need to know right now.
At number 1, this afternoon, President Donald Trump called on governors to allow all places of worship to open right away. He called churches and other religious facilities essential and said he would override any state who says they cannot safely reopen yet.
At number 2, Erie County Executive Mark Poloncarz saying today that hospitalizations have dropped again. This is for May 20th. The data is always a little bit delayed. The Western New York region also tested more than 3,100 people yesterday. That is the second largest day on record.
And number 3, the state is launching what's being called the New York Forward Loan Fund to make more than $100 million available for small businesses. The fund will provide flexible and affordable loans to help small businesses.
All right, let's get into our first question of the day. And we're hearing from some of you as we approach Memorial Day, a lot of people trying to make some plans this weekend and as we head into Monday. Dr. John Torres, the chief medical correspondent for NBC News, offers this for everybody.
This is a weekend where a lot of people are going to start taking their first vacation in the middle of the coronavirus pandemic. So there's certain things you need to think about. Number 1, if you're by a pool or a beach, remember you're more likely to catch coronavirus from the people there than the water itself. So social distancing, 6 feet is important, especially when you're in the water. And if you are having food at a barbecue type situation, the people you invite could be spreading it as well. So social distancing matters there if it's somebody that's outside your circle of trust. But overall food safety is equally important. And if you are opening up your quarantine, the people you trust, make sure it's people that you know have done all the things they need to do to stay safe over the last 2 weeks. And keep hydrated. It's important because we're wearing masks. Remember to keep drinking water.
Those are all good points. And it's going to be a little funky, right, Michael, to be with a group of, 8 or 10 of your friends and to be wearing masks. But, it was so encouraging today to see those hospitalization numbers go down. It really would be a shame if there was a spike after this holiday.
Yeah, it's something the experts are going to be watching very closely to make sure everybody continues to be safe while also trying to enjoy this holiday weekend as much as humanly possible.
I know. It'd just be nice to be together, with family and friends.
No doubt.
For the first time in a while. Alrighty, let's get to a medical question that we got from a viewer. Having a strong immune system is as important as ever. What are proven ways to boost it to fight this virus? Well, we took that question to Kristen Kirkpatrick. She's a registered dietitian with the Cleveland Clinic.
If we look at specific foods, there have been studies on fiber. So getting foods that have enough fiber have helped with immune function. Getting enough greens in particular seem to be kind of a magic elixir for helping that immune system stay in tip-top shape. When we are more in line with our circadian rhythm, our circadian clock, when we are eating during daylight hours, when we're eating as humans should, that helps with overall fat loss, it helps with weight loss, it helps with immunity, it helps with so many concepts.
And when Kristen was saying that, I was kind of looking up some of the things that she was saying there because I had never really thought of that before. And she also added the importance of sleep in keeping your immune system really healthy and pointing out too that, alcohol can really cause problems with your sleep. And so she recommends limiting that. Absolutely.
Yeah. And the more food you can eat that's in the form that it was in when it was picked off a tree or pulled out of the ground is your best bet. Yeah. And it seems like a small thing to do, but it really can make a big difference when you're talking about immunity.
Yeah, processed foods.
Right, bad.
Yeah. All right, so no doubt you have heard a lot lately about the phrase contact tracer. At least 500, almost 600 of them are at work here in Western New York right now. That was a requirement to enter phase 1 of reopening. These people are very important to slowing the spread of the virus.
But Alex asked a great question. He said, can you have the health commissioner explain what the contact tracer actually does once people test positive? Will we hear from an actual person if we get it? Well, here's Dr. Gail Burstein's response.
what the contact tracers do initially is they contact the person who had the positive test, notify them that they have this positive result and explain, what the disease is, explain to them that under the commissioner's orders that they have to be in isolation and explain what that is and when they can release themselves for isolation and where all the information about that is on our Erie County Health Department website. And if, they have problems accessing that, we make sure that that is hand delivered to them in writing so that they have everything they need to be safe and stay in isolation. And then we talk to them about their close contacts. So for COVID-19, a close contact is defined as somebody who was within 6 feet of the individual for more than 15 minutes while that person was contagious. And so we're describing contagious as either 2 days before the onset of symptoms of COVID-19, or if the person didn't have any symptoms, 2 days before they were tested. So that's, we're looking at that contagious period. And so we find out who those individuals were, get information about names and contact information, and then we contact their contacts. Many times those are already people in the homes. Remember, during our phase 0, when nothing was open yet, many people were just staying at home and they weren't going to work, and so they didn't really have a lot of contacts outside the home. So that's going to change now. But however, so far where it's been is most of the time the close contacts have been individuals in the home, but whoever they are, if they're essential workers and they've been to work, and we find out who their close contacts are and contact those close contacts, notify them that they have been exposed and explain to them that they have to be in quarantine. And so, quarantine is different, depending on the individual. So if somebody is an essential employee or say like a healthcare worker or working at a grocery store, they can still go to work during quarantine. They have to wear a mask when they're in work or with other people. So they would go from work to home and work to home. So it's no stopping off and going out somewhere else in the community or going out and doing any errands. They really have to stay quarantined when they're not at work. For people that are not essential workers and they have to stay at home, in quarantine just by themselves, not in contact with other people during the time of their quarantine.
And we should also let you know New York State is still looking for contact tracers. There's a lot more information about that on the State Department, Health Department's website.
Right. All you have to do is go to coronavirus.health.ny.gov and then toward the bottom, click the box that says become a COVID tracer. She was very thorough, wasn't she, Michael?
Yeah, and I have to say some of that I didn't even fully realize.
Right.
So that was great information from the doc. Hey, so Aaron sent us our next question. He asked, when gyms open here, do we know how different they will be? My brother is in Missouri where they're open, but lots of machines are not, areas are blocked off, and locker rooms are closed. So Aaron, gyms are going to look different here, no doubt about that. We don't know all of the specifics, but businesses will have to put together a reopening plan. Here's what we're seeing in some other states. While many gyms across the country remain empty, some reopened today in Indiana and have been back in business for a while in other states like Texas.
Some of our locations, we've had as many as 75 people waiting outside, ready to actually enter our gyms and start working out. It's been, a great start. And there are some people that are going to be, still cautious, which rightfully so. In the Lone Star State, gyms can only operate at 25% capacity, and showers and locker rooms are closed. But those precautions aren't enough to convince every fitness center to reopen.
There's no need to rush getting back into it. Let's take the precautions. Let's make sure people feel safe.
At this open health club, you'll find hand sanitizer everywhere, class sizes limited to 8 people, each with his or her own station, and temperatures are checked at the door.
Pretty good.
One big question in states with open gyms, should you wear a mask while working out?
I see no reason why people cannot exercise while wearing a mask. It may make breathing a little bit harder, but it's not something impossible to do.
Dr. Raed Dweck is chairman of the Respiratory Institute at the Cleveland Clinic.
Especially the cloth masks. They are not tight enough to cause you to kind of re-inhale your own breath, for example. So I really encourage people, especially at gyms, to observe social distancing, wearing masks.
Michael, not only will things be different, but you've got to think that the cost of memberships is likely going to go up because of all these accommodations that all these gyms have to put in place. It is a major change for all of them.
Yeah, it's a lot of work. And the idea of wearing a mask, I mean, in some places they're able to block off entire areas so you stay in your area, but in other instances you might be within 6 feet of people, and so wearing a mask while working out, that is definitely something that will be different.
I get winded wearing a mask going around the grocery store,
Yeah.
so I can't imagine
Yeah.
being on an elliptical or something.
Big change.
Right. Alrighty, let's go on. We've talked quite a bit about the Paycheck Protection Program, almost $700 billion from the federal government given out through potentially forgivable loans to small businesses to help keep workers on the job. Well, there's been some worry about fraud and abuse of this massive program. We talked about that with legal analyst Dennis Vacco, who practices here in Buffalo, and he's a former state attorney general and former U.S. attorney.
The unscrupulous fraudsters who are, looking to make a quick dollar, or the businesses that are not afraid to push the envelope. They just saw this as such a massive program. And the logic is because it's so massive and so many people are applying and receiving the money, there's no way that I'm ever going to get caught. Well, when you think about, we do Medicaid fraud here all the time, where there's investigations by the state attorney general's office into providers or, businesses that are in the healthcare arena, falsifying records, double dipping into Medicaid. Medicaid is also a gigantic pool of government money, but there's a lot of prosecutions in that arena as well. So I don't think that those individuals that are inclined to perpetrate a fraud or to push the envelope, they shouldn't be comforted by the fact that this is such a massive program.
And Vacco also pointed out that federal prosecutors have already filed charges in 3 cases accusing people of PPP fraud. So they're looking for this, and he thinks that number of prosecutions is going to dramatically increase in the coming months.